difficulties with focus, attention, memory challenge, or maybe a sleep problem, trauma, brain injury, and what does too fast speed processing may create? It may create anxiety, OCD, types of behavior. Even it result in sensory processing disorder. So basically, the brain map is showing how your brain is working and what your brain is doing and how is it creating your symptoms. And most importantly, the brain maps show you what a patient needs to do and how does a QEEG brain mapping is done. First, we should record EEG signal. You know that for QEEG, for neurofeedback, first we should record EEG signal. We should put an EEG cap on your client head. And then the EEG cap, which contain electrodes, just reads for brain activity. And how does QEEG brain mapping work? The way that it works, once your brain map has been taken, it gets uploaded to a very large database of brain of all ages, and your brain map is compared to people of the same age. That's how our brain comparison must be done with age-matched people, which is called normal database. And for this purpose, we should know about the EEG or brainwave. Brainwave are basically evidence of electrical activity in your brain. When a group of neurons send a burst of electrical impulse, to another group of neurons, it creates a wave-like pattern. These waves are measured in a cycle of speed per second known as hertz. As you know, EEG cannot be seen with the eyes, and for this purpose, an amplifier is needed that can magnify the signal many times. As you know, by looking at EEG, you can see which frequency band has increased or decreased. But we cannot get the numerical value of each frequency band, while the brain map shows us the value of the frequency band with number. The main use of an EEG is to detect and investigate epilepsy, a condition that causes repeated seizure. And we can diagnose with epilepsy classification of different epilepsy syndrome and presence of tumor or inflammation. You can you can detect with EEG. Okay. And what's the difference between EEG and QEEG? A standard electroencephalogram or EEG record electrical activity or brain wave that are representative of underlying cortical brain activity. A quantitative EEG or QEEG apply sophisticated mathematical and statistical analysis to this brain wave and compare them to age and state control. The QEEG processes allows us to create a brain map through this combination of precise measurement and quantitative comparison. Application of QEEG. The QEEG is used by those currently in a professional practice for the following clinical application: evaluating effect of medication is very important, and predicting medication response, evaluating head trauma, assessment of cognitive and psychiatric change in neurofeedback, and in peak performance assessment and training, as well as other. Function of left and right hemisphere. We can see in a right hemisphere analytic through detail, orient, order, sequencing, verbal, caution, planning, math, or science. And in the right hemisphere, we can see a random, sequencing, emotional, non-verbal, adventure, impulse, creative, functional of the right hemisphere. And then again, the functionality of the left hemisphere is, as you know, thinking in word, linear thinking, visual-based language, such as in mute and deaf people. And again, right hemisphere, you know that about. If a hemisphere damage, you can see this symptom. In the right hemisphere, a person may have trouble with thinking, like attention, perception, and memory, as well as loss of mobility and control of the left side of the body, since each hemisphere control function on a opposite side of the body. And left hemisphere brain damage can lead to difficulty expression and understanding language of the word, sentence or conversational level, trouble reading and writing. Sorry, I should admit one of the friends. Change in speech, deficit in planning, organization, and memory, as those skills related to language. And if right hemisphere brain damage, it can be a person may have trouble with things like attention, perception, and memory, as well as loss of mobility and control on the left side of the body, since each hemisphere control function on the opposite side of the body. And left hemisphere brain damage can lead to difficulty expression and understanding language, the word, sentences, or conversational level. You know that about the lobes of the brain: frontal lobe, parietal lobe, occipital lobe. You can see the frontal lobe, parietal lobe, occipital lobe, and temporal lobe. What does your frontal lobe do? Voluntary movement of the opposite side of your body, sequencing of complex or multi-step movements, such as getting dressed or making a cup of tea, speech and language production, dominant frontal lobe, attention and concentration, working memory, which involve processing recently occurred information, reasoning and judgment, organization and planning, problem solving, and etc. A symptom of frontal lobe damage is related to falling, inability to solve problem or organize a task, reduce creative, impaired judgment, reduce sense of taste or smell, depression, difficulty to control emotion, change in behavior, low motivation, impulsive or risky behavior. And the parietal lobe is vital for sensory perception and integration, including the management of taste, hearing, sight, touch, and smell. A symptom of parietal lobe damage: sensory problem, vision problem, hemispatial neglect, balance syndrome. When parietal lobe is damaged, while vision and perception are usually considered a function of the occipital lobe, the parietal lobe also play an important role in vision. Okay, this is because the nerve. Sorry, I should remove the laser because. Play as an important role in vision. This is because the nerve fiber that carry visual information must pass through the parietal lobe on their way to the occipital lobe. Though, if the parietal lobe is damaged, those nerve signal can travel as easily, and parietal lobe damage make it more difficult to process certain visual information such as length and depth. This leads to poor hand-eye coordinate and balance, as well as several their eyes problems. The temporal lobe is one of the four major lobes of the cerebral cortex. It is the lower lobe of the cortex sitting close to ear level within the skull. And it's related to broca area, limbic system, and vermic. You can see symptom of temporal lobe damage is difficulty in recognize face, difficulty in understanding a spoken word, Wernicke aphasia, disturbance with selective attention to what we see and hear, difficulty with identification of and verbalize about object, short-term memory loss, interference with long-term memory, increase and decrease interest in sexual behavior, inability to categorize object. Dry lobe damage can cause persistent talking, increase aggressive behavior. And ringing in the ears, it means tinnitus. And occipital lobe processing, the occipital lobe again is one of the four truss source major brain lobe in the human brain. The occipital lobe is so named because it rests below the occipital bone of the skull, and it's also the smallest of lobe. It's very important. The occipital lobe is related with a sleep disorder and learning disruption. Okay. And the amplitude of a periodic variable like EEG is a measure of its change in a signal period, such as time or spatial period, the rate at which something occurs over a particular period of times or in a given sample. In physics and mathematics, the force of a periodic function f of some real variable t is an angle-like quantity representing the fraction of the cycle cover-up to t. And you can see brain signal category. You know that delta, theta, alpha, beta, and gamma. This is a slow wave, delta, theta, and alpha between 8 to 10 hertz is related to slow waves, okay? And beta and gamma and alpha between 10 to 12 hertz is related to fast brainwave or fast speed. And you can see again brain signal category according to the QEEG or NeuroGuide software. You can see that. You know that delta between 1 to 4 hertz or 0.5 to 3 hertz, okay? But now, it's according to NeuroGuide software, delta is 1 to 4 hertz, theta 4 to 8 hertz. You can see that. Delta wave related to sleep without dreams, especially speed stage 3 and 4. And good measure for defining depths of deep sleep, dominant wave in babyhood, decision making, affecting the formation of explicit memory. It's very important. It's related to artifact of eye movement and ear movement. Okay, you can see maybe you see eye movement, and it's delta wave. Okay, same like delta wave. Maybe mistake with delta. Increase in amplitude of delta wave. Brain damage, artifact of blinking and eye movement, learning disorder, especially in the left hemisphere, the Wernicke's area, and drowsy brain, impulse control disorder, drug use such as gabapentin, zolpidem, gamma, hydroxybutyrate, and chronic trauma, hyperactivity, social and cognitive impairment, sensory integration, dysfunction. You should know that the QEEG, green is a normal. Green color is a normal, okay? And red means increase the frequency band, and blue means decrease frequency band. Normal is green. When we say that increase delta, as you can see, increase delta, it means the red color. It means red color. Okay. So when we talk about increase in amplitude of delta wave, you can see red color on a map. If increase delta in a frontal lobe is related to hyperactivity, impulse control disorder, social and cognitive impairments, and if increase on a sensory motor cortex is related to obsession. If it's increased on a parietal lobe, it's related to obsession again. If increase delta on occipital lobe, it's related to sensory integration dysfunction. And if increase delta on a temporal lobe, it's related to obsession. Include T4 and T6. And if it increase delta on global, it's related to chronic trauma. But maybe a mistake with eye movement artifact, okay? So we should remove this artifact. If decrease delta wave is related to memory problems, especially working memory, alcohol consumption, performance disorder, inefficiency, irritability, fragile feeling, low self-confidence, vague thinking, weak emotional recovery, censorship, slow reaction time, weak calculation, weak judgment. If decrease delta on a frontal lobe, it's related to working memory. If decrease on an occipital lobe, it's related to memory disorder or autism. In the brain map, you can see the color of the brain. Theta wave. Theta wave is between 4 to 8 hertz. Theta amplitude, you know that theta amplitude is larger in children than in adults. And the theta amplitude is often the same in the two hemispheres. You know that theta should be equal on the left and right hemisphere, okay? Sorry. It's related to dream, deep meditation, hypnosis, daydreaming, and sleep. And long-term memory, impulsiveness, attention maintenance, and focus. Creativity, finding the new solution, being inspired, sixth sense, interior attention, insight, divergent, and sensorless thinking. You know that censorship is a frontal work, okay? If increase in amplitude of theta wave, it's related to hyperactivity, impulsiveness, abrupt decision, confusion, weak sensory integrity, slow reaction time, and learning disorder, executive dysfunction, frustration, low tolerance threshold, emotional intensification, depression, anxiety, and mood disorder. It's related to increase theta. If increase theta on a frontal lobe, it's related to hyperactivity, increased theta in this part. It's related to hyperactivity, impulsiveness, obsession, left more than right, okay? Bipolar, especially right frontal, depression, especially on F3, and periodic drowsiness. If increase on a parietal lobe, it's related to obsession, especially P3 and P4. And if increase theta on a temporal lobe, again, it's related to obsession. And you know that with neurofeedback, you can decrease these waves, okay? You can make protocol for disorder. If increase theta on an occipital lobe is related to confusion, weak sensory integrity, and obsession again. And if increase on a sensory motor cortex, it's related to obsession again. Increase theta is important. Increase theta asymmetry at two hemispheres is related to mood disorder, anxiety, and depression again. If a decrease in amplitude of theta wave is related to memory disorder, low emotional awareness, and negative thoughts of mental rumination, imagination, and daydreaming, and if decrease theta on a frontal lobe is related to memory disorder, low emotion awareness, and if decrease theta on a parietal lobe is related to short-term memory disorder, especially on PZ, and if decrease in occipital lobe is related to short memory disorder, especially in OZ, attention disorder, and autism. And on a CZ is we can see short-term memory disorder if decrease theta. In this slide, you can see this brain mapping is belonging to 18 years old lady with anxiety, impatience, and lack of attention and focus for studying. You can see increased theta because this head is related to theta. Okay, you can see theta in this part, and theta increase because the color of this head is again is yellow. Yellow means increase again. Yellow and red means increase, but blue means decrease. And again, alpha increase on a frontal lobe. You can see this is this part is frontal. Okay, you can see this picture. All of them we can see frontal. This is a temporal lobe near the ears, and this is the occipital lobe. For brain mapping or QEEG, we need 19 channel. Again, you can see a map. It's belonging to 18 years old male with personal disorder type B, especially borderline personality disorder. You can see increase again theta and alpha on a frontal lobe again. Next slide. This is an alpha wave. Okay, alpha wave is between 8 to 12 hertz. We can see two types of the alpha. One of them is low alpha, another is high alpha. Low alpha between 8 to 10 hertz and high alpha between 10 to 12 hertz. The dominant wave is again is very important because the dominant wave at occipital lobes at resting state with eye closed, and the main source of alpha, and you know that main source of alpha is thalamus. Alpha wave is related to alertness, peacefulness, readiness, and meditation. Alpha blocking, decrease, that decrease and even full blocking of alpha by opening eyes. When we close eyes, when we close eyes, we can see increase alpha on an occipital lobe. But when we open eyes, we can see decrease alpha. It means blocking alpha. But inversion of this relation may signify drowsiness. Increase in amplitude of alpha. It's related to anxiety, phobia, down mood disorder, sleep problem, hyperactivity, traumatic brain damage, marijuana consumption, and frontal. If increase in the frontal is related to daydreaming, hyperactivity, depression, brain damage, marijuana consumption, apathy, social anxiety, bipolar disorder, increase in F3 and F4. As you can see to this picture, increase alpha on the frontal lobe, on the F3 and F4. Frequencies higher than the average of alpha waves sometimes signifies higher intelligence. And asymmetric alpha is seen in depression. You know that alpha left hemisphere should be high. And alpha amplitude in the left hemisphere is higher than in the right hemisphere. In depression, you can see this. Decrease in amplitude, decrease in alpha amplitude. In anxiety, down mood, low motivation, insomnia, body not being relaxed, short-term memory disorder. It's very important. Both increase and decrease in amplitude of alpha wave causes a sleep disorder. Okay? Because when increase alpha, it means rumination. Okay, so we cannot sleep. PDR means post-dominant rhythm. Alpha is a dominant posterior rhythm among adults and is almost equal in both hemispheres. Decrease in PDR sometimes signifies brain performance disorder, and lack of symmetry probably propose cognitive impairment. You can see PDR decline lower than 10 Hz in depression. Problem solving and comprehension with eyes open cause suppression of posterior alpha. Because when we open eyes, alpha should be blocked. If a person cannot do that, it's because it's related to mental fog. Some children or adults suffering from hyperactivity are not capable of suppressing a slow wave. Such as alpha, while wanting to focus, and alpha sometimes even increase open cognitive tasks, which is also called cognitive inversion. Decrease in alpha amplitude. In the frontal lobe, it's related to obsession, anxiety, depression, depression, drug abuse, especially the left side more than the right side. In the parietal lobe, obsession and short-term memory, especially on PZ. In occipital lobe, confusion, drowsiness, and sleep disorder, autism, and sensory motor cortex, short-term memory disorder, and obsession. You can see obsession all of the part. You can see obsession. Slow wave disorder such as delta, theta, and alpha, or slow EEG. Buggy thinking, slow reaction time, weak calculation, weak judgment, weakness in impulse control again. Sorry, wait a minute, please. Sorry. Beta wave between 30 to 35 hertz. In beta waves include SMR or sensory motor release between 30 to 15 hertz. We can see this frequency on this part. Beta 1 between 30 to 80 hertz, beta 2 18 to 21 hertz, high beta 22 hertz to 28. And maybe you can see beta is standard between 30 to 21 hertz. In some source, you can see beta standard. I should admit one of the friends. Beta wave between 13 to 15 hertz in sensory motor cortex, C3 and C4. Dominant wave at the resting state, yet focus on and paying attention to a topic. Dominant wave while brain processing problem, calm mental state, wave of sleep spindle at stage 2, and we can see in non-REM sleep, it can include 12 to 14 hertz. Amplitude of SMR increase is important again. Amplitude of SMR increase when the person is emotional and decrease when moving. Related to hyperactivity, how of the hyperactivity hold increase SMR? We should increase SMR in hyperactivity. Okay, we should increase SMR. Continued decrease in amplitude of SMR cause cognitive disorder. Application of training in increased amplitude of SMR by neurofeedback in hyperactivity, learning disorder, epilepsy, autism, and training in increased beta at CZ cause increase in alertness by training in increased SMR at CZ cause reduction of impulsiveness and hyperactivity again. Beta wave. A beta wave is related to calm thinking, focus, and attention maintenance, problem solving, navigation, optimum performance, and cognitive processing. Maximum beta amplitude is at posterior and central area. In neurofeedback, we can see this part. It should be increased on a anterior. A dominant beta frequency in adults is higher than in children. Amplitude of beta sometimes increase in sleepiness. Contrary to alpha wave, amplitude of beta wave do not alter by opening and closing eyes. But you can see increase alpha when we close eyes. Unlike beta. Increase in amplitude of beta wave is maybe this is differential from EMG artifact, okay? Of head surface muscle, beta hold regular signal while EMG runs in bursts. Anxiety disorder and physical disease arising from chronic anxiety such as colitis, heart arrhythmia, respiratory problem, headache, and migraines. Obsession, depression, anxiety, overthinking, again related to increased alpha. Insomnia, alcohol abuse, retinitis, and learning disorder may be increased beta. If increase beta on the frontal lobe, it's related to bad news expectation. Chronic worry about potential unpleasant incidents, irritability, hyperactivity, obsession, mental rumination, depression, and anxiety again. If increase beta on occipital lobe, it's related to emotional instability, negative mental rumination again. Decrease in beta wave amplitude. It's related to down mood, executive dysfunction, lack of focus, cognitive problem, and if decreased beta on a frontal lobe is related to executive dysfunction and ADD. If decreased beta on occipital lobe, again related to focus disorder and obsession. Do you have any question or not yet? Okay. I can't hear. Sorry, I can't hear your voice. Wait a minute, please.
In your lecture, you have mentioned.
Okay, please. Yeah. Please
hear
repeat
me?
the question.
Sorry?
You're welcome.
Yes, thank you. In your lecture, you have mentioned about of the sixth feeling, yeah, sense or sixth sense. I would like to ask or to know what you understand under sixth feeling, and has this sixth feeling any topics in the brain, and is it possible to recognize of the presence of this sixth feeling through the EEG waves?
Yes. With EEG waves, we can see. Yes, we can see because sixth phase is related to theta wave. Okay, when theta wave is dominant, it can lead to sixth feeling. Okay, but with EEG waves, because raw data, because EEG is a raw data, okay, and maybe we cannot see theta wave, we cannot detect theta wave. But when you see an QEEG or brain mapping, you can see theta wave.
May I repeat the question, the first part of the question? What is the sixth feeling?
What is the sixth feeling? Sixth feeling.
Intuition or something else, or intuition, no? The ability of the person to make decisions or to make clear without eyes, without oars. Usually the people say that feeling is the ability is an ability to recognize something through the intuition. Yeah.
Yes, that's right. Yes.
Yes.
It's related to sixth feeling. Yes.
Thanks.
You're welcome. Okay, and we can continue. Okay, do you have any question? No?
No more at the moment.
Thank
you. Hello?
Hello?
Yeah, I wanted to ask, the material, I like the lecture. Is there a way we can get this material? That's what I want to ask.
Sorry, please repeat again.
Hello, I said the lecture notes, is there a way we can get this lecture notes? That's what I wanted to ask.
Yes, you can. Yes, consent.
Okay, and there are references at the end of the lectures.
On this reference, this source is related to a book, but each activity, but now I can't remember it, and I sent in a WhatsApp group.
Okay, all right. Thank you.
Next frequency band is high beta. It's between 22 to 28 hertz, increase in high beta amplitude, increase in hypervigilant irritability, very fast cognitive processing, and optimum performance. Obsession, overthinking, and mental rumination. Again, it's related to insomnia, anxiety, depression, and autism. In autism, especially at occipital, we can see increased high beta or increased theta. Unlike ADHD. Decrease in high beta amplitude is related to download, obsession, hyperactivity, especially at T3, T4, and P3. And gamma wave. Gamma wave is tightly related to performance of neural network and affect major activity of brain and mind. Gamma synchronize is related to cognitive processing at all levels of brain, and gamma helps brain organization, learning improvement, and increased mind alertness. Most learning disorder or psychological impairments are corrected with lack of gamma, and 40 Hz rhythm emerge in children and adults solving problems. Okay, technical standard for EEG recording system. Sampling rate or sampling frequency defines the number of samples per second. You know that, okay? Taken from a continuous signal to make a discrete or digital signal. A sampling rate for E-wave device for this device is 500 Hz. For EEG recording, usually these filters are used, a low-pass filter, 40 to 70 Hz. A low-pass filter is a filter that passes signal with a frequency lower than a select cutoff frequency. And again, there is a high-pass filter. High-pass filter is an electronic filter that passes. Can you mute your voice?
I want to ask something.
Okay. Here.
Is it okay? Can I ask? Can you compare with the filter frequency or artifact frequency? What is the difference between those things?
Yes, we can filter. Yes, we can filter because for EEG we can set between 1 Hz to 40 Hz. Okay, you can filter the high pass and low pass. Because for example, for EMG or electromyography, you need 1 Hz to 200 Hz. Okay, you can set it with software. With right click on a scope software, you can set it.
Thank you.
One of the most important filter is AC filter or notch filter. This filter removes power line noise. Okay. Again, you can set this artifact. If you want, you can remove power line noise.
The frequency of the high pass filter?
High frequency means high pass filter. Yes, high frequency. No, we can set the filter. Okay, we can set the filter for EEG or EMG. For in EEG,
In your PowerPoint, you have mentioned it is 1 hertz, whereas low pass you have mentioned as 40 to 70. That's why I asked.
No, with a low pass filter, we can pass signal with a frequency lower than the select cutoff frequency. But because the frequency band for EEG between 1 hertz to approximately 500 hertz. Okay? Sorry, 50 hertz.
Thank you.
We can remove just, but we can remove just 50 hertz. Because it's related to power line noise, we can remove it. Montage are logical orderly arrangement of electroencephalographic derivation or channels that are created to display activity over the entire head and to provide lateralizing and localizing information. Most often bipolar and referential montage are used for routine EEG, you know that, okay? It's important for EEG, but for QEEG or quantitative EEG, link years is very important. It's often used to QEEG recording. The simplest and often used montage is a linear approach. In this montage, the electrode potential at individual electrode sites are measured with reference to two link electrode located at the left and right ear. This is a linker. And this is a bipolar montage, is used for EEG montage. For EEG, this is, for example, this is active and this is reference. Okay, again, this is active, reference, active, and reference. It's the same banana fruits. And we can say banana montage. Artifacts are signals recorded by EEG, you know that, but not generated by brain. It comes to, for example, Mayo. What are the artifacts in EEG? Physiological, we have two types of different artifacts, physiological artifact and non-physiological artifact. Physiological artifact may include a cardiac pulse, respiratory, sweat, eye movement, such as blink, lateral rectus sparks from lateral eye movement, and head movement, muscle, and movement artifacts. Non-physiological artifacts may include EEG system, electrodes, the surrounding. It's a non-physiological artifact. You can see eye movement artifact. In this picture, you can see eye movement. Eye movement artifact is related to frontal okay, frontal area, because it's near the frontal. In EEG cap, there are seven points, and it's related to the frontal. FP1, FP2, F3, F4, F7, and F8, FZ. Okay, this is frontal lobe, and you can see artifact movement, eye movement. You can see this type of the artifact in these parts: FP1, FP2, F3, F7, and F8. But you can edit or you can remove this artifact by the software. Parts FP1, FP2, FP1, and you can see the type of the artifact about eye movement. On a F7 and F8. You can see this artifact, this part. On a F3, on a F7 and F8, you can see eye movement artifact. Jaw muscle artifact is mainly on T3 and T4. Why we can see this artifact on T3 and T4? Why we can see? Why we can see jaw muscle artifact on T3 and T4? Why, do you know? Because these artifacts, okay, is close to jaw muscles, okay, it's near to these muscles, and we can see this artifact on a T3 and T4. Neck muscle artifact is mainly on O1 and O2 point, because why we can see this artifact? Because it's near to, close to neck. Jaw muscle artifact is mainly on T3 and T4 point because it's close to jaw. It looks like a beta wave. So when you want to record a signal, you should say that please open your mouth. In this picture, you can see head movement artifact again. In this picture, you can see power line noise. As you can see, this artifact is shown on every channel. Every channel maybe have this artifact. Okay, when we record EEG via Bluetooth, this type of artifact is removed. You know that about the 10-20 system? Each electrode plays placement site has a letter to identify the lobe or area of the brain. It is reading from prefrontal. This is a prefrontal. Okay, this is a frontal, prefrontal, frontal, temporal, parietal, occipital, and central. You should know that even number electoral such as 2, 4, 6, and 8 refer to electoral placement on the right side of the head, whereas odd number such as 1, 3, 5, 7 refer to those on the left hemisphere. F3, F7, C3, T3, P3, T5, O1 on the left side. In this picture, you can see an EEG cap designed by a Science Beam company. Again, you can see the cap. Next step to be familiar with QEEG setup. In this picture, you can see all the device and accessory need for the QEEG setup. Here you can see in this picture a USB cable, cap, 1020 paste, ear clips, amplifier or devices, and gel and the pack of the device. And next slide, we talk about what is QEEG or quantitative EEG. EEG is a measurement of electrical pattern at the surface of a skull, which reflect cortical activity and are commonly referred to as brainwave. Brainwave QEEG is the analysis of the digitized EEG, and in lay terms, this sometimes is also called brain mapping. The QEEG is an extension of the analysis of the visual EEG interpretation, which may assist and even augment our understanding of the EEG and brain function. In this picture, you can see EEG and QEEG again. The software do this work. How to get color brain map? How to get color brain map? Do you know that? Do you know that how to get color brain map?
I will try to answer. I think or I believe that the software choose the frequency, and definite frequencies are changed into the color. Yeah, and blue color is low frequencies, I think, and high frequencies must be red, yellow, and red. and these colored areas, they show the active areas in the brain, in the cortex, at the moment of measuring.
Yeah.
So,
Yeah. Thank you. Mm-hmm. So continue, please.
I have so much to say, not more.
Uh-huh.
You will correct me.
Thank you for answering. Thank you for answering. But you know that when increase, you know that theta and delta wave, okay, delta and theta wave is a low frequency, has a low frequency, okay, it's a slow wave. This is they are a slow wave. But maybe this type of brainwave maybe increase again. Maybe delta increase or theta increase again. Mm-hmm. But now I explained about that. For the first step, you can see the head, okay? For the first step, we record EEG. We record EEG from 19 points. After FFT analysis or fast Fourier transform, we get power of frequency band. Mm-hmm. You can see FFT analysis, and then you can see delta, theta, and alpha. This number will be compared with the normative database. It's very important, okay, because in this software there is a normal database, and we can compare with this. According to the normal distribution curve, we will get the color brain map. As you can see from the normal distribution curve, green shows normal value, the red color shows higher value than the normal value, and the blue shows a lower value than the normal value. Again, you can see green means normal, blue means hyperactivity, but this hyperactivity maybe it's related to delta, theta, beta, or another brain wave. But it's better now all of the point, okay, it's very important. For example, this is the frontal, FP1, FP2, this point is FP2, F3, F4, FZ, CZ, PZ, okay, and C3, C4. And this is normalized data was invented by Professor Robert Thatcher. NeuroGuide provide access to modern and simple to use Microsoft Windows for automatic artifact rejection, dynamic lifespan, eye open and eye close, reference normative database covering the age from 2 months to 82 years of age. the normal database according to these aids. QEEG keywords: power, amplitude, absolute, relative, symmetry, coherence, phase lag, and peak frequency. Definition of the keyword. The power, the square of the microvolt per hertz. The raw data are converting to the power by the NeuroGuide software. Absolute power is represent the absolute value of the electrode measurement without the physical characteristic of the scalp. Again, you can see absolute power in each band, relative power, percentage of absolute power divided by total power, and again, their power ratio, power of each band divided by another band. We can see this keyword on a NeuroGuide software. Absolute power, relative power, and power ratio. Power of each band divided by another band, it means power ratio, and you can see one of the most important of power ratio is theta beta ratio. You know that. Theta beta ratio, we can detect ADHD disorder with this parameter. Okay. If you are agree with me, we can again start after 10 minutes. Okay. After 10 minutes, we can start again. Do you agree? Yes. Thank you. Okay, after 10 minutes, we can start. Come back. Goodbye. I think it's better to do practically first for a better understanding. Okay, and then we can continue again theory. Right. For this purpose, we should again go to click on a software. Can you see software? Can you see it? Yes. And then we should click on a template. This is a template. After that, we should select the evaluation 19 channel because there are a lot of protocol in this list. And now we should select evaluation 19 channel. Evaluation 19 channel is related to QEEG. Evaluation, there are a lot of protocols such as evaluation 4 channel, evaluation attention index, and etc. But now I want to select evaluation 19 channel for recording QEEG. As you can see, there are 19 channels in this page. FP1, FP2, F3, F4, and PZ. First, we should connect the device for this work. But you can go to a menu help again. This is a menu help. And you can see again the montage page. This gap for recording AG. And there are 19 points in this, as you can see in the picture. And we should connect this device to the, we should connect it to the device. And now subject is ready. First, we should measure according to 1020 system. From nausea to iron point, it's 40. We should highlight CZ. Again, we should highlight CZ with gel, and then we should put the cap. This cap has a 21 channel, but for QEEG recording, just we need 19 channel, okay? First, we should put cap. And we need ear clips again. This is the ear clips for connecting the reference. This is the ear clips. Ear clips. We should connect the reference according to the montage head. There are two references for this cap. And it has a green color. This is a reference, okay? The green. This is the amplifier, E-wave device. There are three ports for this cap. And we should turn on the device. Now, I click on a record page and setting the device. I want to connect the device via Bluetooth, okay? So we should search the device. Okay. Now it's fine. Then we should close the software and play it. You can see noise. All of the points have a noise. Okay. When we inject gel, we can see a good signal. Again, we need ultrasonic gel. Easy. If we inject gel, we can see good signal point. FP1, FP2. Can you see FP1 and FP2? I want to see the software. FP2, it doesn't have any noise. FP1, FP2, F3, F4. When I'm injecting gel, noise was removed. Can you see the signal? FP1, FP2, F4, and F3. I should inject gel all of the point. Again, we need a gel. P3. Z. Sure. And now all of the point has a good signal. Put P3. P3. This subject has a lot of hair and it's very hard for him. Because he has a lot of hair and yeah. Can you see the signals?
Yes.
Yes. Thank you. Please press your teeth. Can you see the EMG artifact? This is an EMG artifact. Okay, stop. And please close your eyes. When the client close his eyes, you can see the alpha wave. Can you see the alpha wave? You can see the alpha wave on here, O1 and O2, now occipital lobe. And behind of the head, you can see alpha wave when the client close eyes. Please open your eyes and eye blink. Please eye blink. Can you see the eye blink on FP1, FP2, F3, F4, F7 and F8 and FZ? This is an eye blink. And we can change the theme of the back of the theme. Can change theme, black, white, with right click. When you right click, okay. When we right click, when we right click on a scope, we can see the setting, montage, data stream, and AC filter, and 10, and we can change it. After that, we should stop the software and we should record it, okay? Again, we should go to this page, user, and we should add this parameter. Okay. This parameter we should fill it, personal ID. We can fill this part, but yesterday for this client has there's the name of the client in this part. Oh, cannot see. and I select the name of the client, and I write the event, QEG. We should write it, QEG. And for QEG, as you know, for QEG, age is very important. QEG and the EO means I open, EC means I close. Okay, EO. Now I want to record EO. We should record both of them. I open and I close. We need two events for QEG. I open and I close. Okay, and then save it. I save the data. And wait a minute, please. Save enable and play it. Please see. I open. Yes, this is I open. We should record for 4 minutes. You can see eye movement on F7 and F8. We can see time of the record on top of the page. Again, we should eye movement on F7 and F8. There are eye blink on this point, and FP1 and FP2 again. After that, we should stop. After that, we should stop, and then we should go to this page. No, you cannot see this. Again, we should select the name of the client, and this is the QEEG. Again, we should write a comment, QEEG and EC. EC means I close. We need two events, okay? Please close your eyes. You can see alpha wave and occipital lobe. Can you see alpha? Can you see alpha on the back of the head? This is the alpha wave. On the O1, O2, P3, T5, PZ. Okay. After 4 minutes, we should stop the software, okay? But now it's a 2. But I stop it. Do you have any question about the device or software? Wait a minute, please. Do you have any question? Do you have any question about this part?
No.
Why do you have to stop after 4 minutes?
Yeah, we should stop after 4 minutes. Okay, but for brain mapping, just we need 2 minutes. Okay, we record 4 minutes because maybe we have artifacts. Maybe we have artifacts, and so we should record 4 minutes. Because now I don't have any artifact, so I record just 2 minutes.
Hello.
Hello, Doctor.
Yeah. Is it possible to connect kind of small with the EEG cap for the infant or a child in between 2 months to 9-year-old.
Yes, we can use. Yes, we can use EG cap. No, you need another cap. There are three sides of the cap: a small, medium, and large.
Is it available along with the software or system?
Yes.
Is it available with the system? Yeah. Okay. Thank
Yes.
you.
After that, we should go to analysis page and we should select the data, open, and again there is this page, and select the name of the client. We can see this record. It's belong to now. You can see the time of the data. It's a eye open. After that, we should convert to the NeuroGuide software. Say NG. NG means NeuroGuide software. Again, another. Because there are two records. Save NG again. I close and I open. Both of them should be converted to NG. But with this device, I forgot to say that. But this device, you can record a hospital EEG again. Okay, you have a menu template, and you can see hospital EEG, hospital EEG. This protocol is belong to hospital EEG, and there are 4 events for hospital. EO means I open, EC I close, and flash and HV it means hyperventilation. And there are a lot of montage in this page. You can see a lot of montage. There are, you can breathe. You can again. You can make a montage if you want. You can write it in this page. You can use just for EEG recording. Okay, but for QEEG. We should go to evaluation 19 channel. Now it's converted. After that, we should go to a NeuroGuide software. This is a NeuroGuide software. For getting brain map, we should go to this software and select this, open, and text file to the text. And again, we should select the name of the client. Okay. The name of the software is Science Beam. You cannot see this page. Wait a minute, please. should share with you. This is the NORGUIDE software. And then we should click on a file, open, and text file again. And now I select the data, eLife. The name of the software is eLife. And record file, the name of the client, and select the name of the client. And we should fill a text file parameter, include sampling rate. It should be 500. And you can select the name of the device is Science Beam. But in this version, those are the other, okay. And we should fill this parameter, name, age, gender, handiness, and other things. We should write again. Name is Sally, age 28. The event is I open. It's very important. You should feel it's necessary. You should feel I open and age. You should write age. Okay. Gender, male, and left. Handiness left. After that, you can write medication. If the client uses medication, you can write it. You can write comment in this part, and okay. After that, we should remove artifact. Okay, there is an artifact. As you can see, this is an artifact. Can you see the mouse? I think you cannot. Mouse. Can you see artifact in this page? There are artifacts. This is iBlink. On the FP1, FP2, F3, and F4, we can see artifact. After that, this part, can click on you should click on edit, automatic edit, and then generate edit. Okay. Can you see the color of the signal? Can you see the colors?
Yes, yes.
Yeah. Pink means a good signal. Blue is not good. And white is also. You can select. If you want, you can select the white colors. But pink is a good signal. You can remove this type of artifact. But if you want, you can remove. Maybe you can see the artifact in a color part, in a pink part, okay? And if you want, you can remove it. you want, you can remove this part. There are two parameters, such as split off and test retest. It should be in upper 0.9.
Could you repeat that?
Yeah.
What are the parameters that decide a good signal?
Yeah.
When does it become pink?
Uh-huh.
And when it goes green and blue mean?
It should be 0.9. It should be 0.9. Split off and test retest. The reliability of the signals.
Okay. So it takes for one epoch and compares with another epoch.
It's a comparison the second, the first part and second part of the duration. Okay.
Okay. Yeah.
Comparison in this part. After that, we should go to report and generate analysis. And we can see interpretation. We cannot see this page. This page is related to subject information, availability of the signals. And this page is related to Z-score FFT summary information. Can you remember about this client? Beta is very low. Can you remember? Beta is very low for this person because yesterday we recorded an evaluation. We recorded a signal from this person. Yes. And the beta wave for this client is very low. And theta increase. In this page, you can see delta, theta, alpha, beta, and high beta. Okay? Can you see delta, theta, alpha, beta, and high beta?
Yes.
Yes. And theta, the green is normal. Delta in absolute power is normal now. And theta is increase. In this person, theta increase. Which part increase the theta? Which part increase theta? Do you know?
Frontal?
Yes, frontal. Theta increase in the frontal. And again, alpha increase. Can you see alpha increase again.
In Pareto?
Yes, the parietal increase, yes, but alpha increase, yes. And beta, again, beta decrease or increase. Beta and high beta are a high frequency, yes, are a fast wave. But theta and delta are a slow wave. In this map, you can see increase a slow wave and decrease
High waves, decrease in high waves.
yeah
For example,
yes, decrease high frequency such as beta and high beta. Yeah. And maybe this person has a ADHD or attention deficient. Okay. Next page. This page is belong to the Z-score. It's compared with the normal database. Yeah. It's compared with normal database, but this page you can see it belong to just the client. It's just for client. Again, this page is just for client. It doesn't any Z-score, but Z-score is important. Again, there is a Z-score, okay, because compared with normal database. Can you compare this page with this? Can you comparison? Please compare to this page. Delta. Now you can see delta between 1 to 4 hertz. Okay, but you can't see this. In 3 page, you can't see the frequency band. Just you can see delta. Again, you can see theta. Theta between 4 to 8 hertz. Alpha between 8 to 12 hertz. Again, beta. It is SMR. Beta between 12 to 25. Now we can see detail of the brain wave. You can see the detail of the brain wave. High beta, alpha, alpha 2, alpha 1 and alpha 2. You can see 2 alpha in this page. Alpha 1 and alpha 2. We can see 3 beta in the 3 beta in this page. Beta 1, beta 2, and beta 3. Okay. It's shown totally. Page 3, you can see totally, but in this page you can see detail. Again, I want to explain about relative power and absolute power. Again, you can see in relative power, beta is decrease. And you can improve beta with neurofeedback. Another keyword is the power ratio. Power ratio, delta, theta power ratio. Can you see theta, beta power ratio for this client? Because theta increase and beta decrease. You can see the color of map. And again, you can decrease the theta beta ratio. Again, this data this data is belong to the client. Not comparison with database. Again, in this page, you can see the detail of the frequency. 1 Hertz, 2 Hertz, 3 Hertz, and 4 Hertz means delta. Okay, 5 Hertz, 6 Hertz, 7, and 8 means theta. It's belong to absolute power. A slow wave increase. Can you see a slow wave? A slow wave increase. 1 to 10 hertz is a slow wave, and 10 to 30 hertz is a fast wave. And you can see decrease. Again, it's related to relative power. As you know, decrease SMR and beta and high beta. Now, if you want, you can make a protocol for this person with the software. Okay, do you have any question about this part? And if you want, you can compare left and right side with each other. When increase, for example, alpha on a left side, maybe client has a depression. You can see alpha increase on a left side. Again. And amplitude asymmetry and coherence, again, is related to network of the brain. In a normal person, it should be without any lines. Okay, and red lines means increase and increase asymmetry, and blue lines means decrease asymmetry. Asymmetry is connection of the the brain. and it's related to amplitude. But coherency is related to frequency band. Okay, we can come back to the slide and can you see a slide?
Yes.
Yes. Symmetry ratio of power in each band between a symmetrical pair of electrodes based on amplitude, as you know, shows energy dispensed in brain. No similarity is called asymmetry. In depression, you have left hemisphere. The left hemisphere increased at alpha theta in the left hemisphere. Compare right hemisphere. If you can remember, there is normal front to back compression. Anterior beta should be more than posterior beta, and if the problem in equation, we have insomnia, anxiety, and hyperactivity, it's related to asymmetry, okay? Because it's referred to amplitude. Again, we have coherency, a measure of synchronization between activity in two channels, and it's referred to the frequency band again. In this slide, we can see QEEG solution at ADHD decrease the energy of the delta in absolute and relative power in various lobes of the brain, increase the energy of alpha, beta, and theta. If we say increase, it means red, okay? Increase the energy of alpha, beta, and theta, or any combination of them by more than 1.5 times of the STD, it means a standard deviation above the signal average in a frontal lobe in ADD marker, okay? In 10-20% of ADHD cases, increase the energy of alpha, beta, and theta, or any combination of them by more than 1.5 times of the standard at the region of T6 to P4. Increase the amplitude of theta by 1.5 times of the STD at the region of FP1, FP2, F4, and F8. Again, is related to ADHD. Increase the coherency of the FP1, FP2 location, and O1, O2 location. You can see in the 34 page in NeuroGuide software, and increase the fraction of the theta beta ratio at CZ point is related to, again, attention index. Increase the fraction of the theta SMR at CZ point, again, compulsive behavior. In ADD case, increase the energy of alpha at the region of P3 and P4. And Asperger, learning disability, again, you can compare with each other. And depression, X is left frontal theta, X is left frontal alpha, X is right frontal beta, asymmetrical axis. When we say asymmetrical, we can see a lot of line on a brain. Asymmetrical axis in the amount of the theta on the left frontal as opposed to the right frontal. Asymmetrical axis in the amount of alpha on the left frontal again. X is theta at CZ, X is alpha at CZ, X is beta at CZ again, and etc. Frontal hypercoherency. When we say hypercoherency, we can see a red line. Okay, red line on a hypercoherency. In anxiety disorder, again, decrease occipital alpha, decrease occipital theta, increase frontal alpha, increase frontal theta, alpha, and sometimes beta, increase upper alpha. And again, some disorder, you can see focal axis of 1 to 7 hertz. And we can decrease 1 to 7 hertz and increase 15 to 21 hertz affected area. Stuttering. In a stuttering axis focal slowing 1 to 10 hertz at F7 or F8. Reduce coherence between F7 and other areas, decrease and we should decrease 1 to 10 hertz at F7 and F8. And in a Parkinson, again, we have this characteristic, spelling difficulty, there are sources for this table, and I can send it for you. And with neurofeedback, and we can increase or decrease these items via neurofeedback software. You can go to template, and if you want, you can make a protocol. There is a custom protocol, open it. And you can make a protocol, for example, on a FB1, you can make it. For example, you can increase, you want to increase theta, okay? And if you want, you can increase theta or increase SMR with these protocols. And you can set the logic of the feedback. And it depends on a client. You can do according to the table, according to the brain map, you can make a protocol for yourself. Okay, do you have any question about this part?
I have a question.
Okay.
On the one slide you have shown the wave features of the depression. I have found about 12 features signs, yeah, and I would like to know or ask, do you have any information are there specific characteristics of the brain wave, EEG wave, for the persons who have great predictive abilities? Futurologists, I mean, futurologists, they can say about future. Do they have any specific features, peculiarities in the our brain wave?
Yeah, they have a specific features about which disorder?
Sorry, I mean, I ask about the persons who have predictive abilities. They can say definitely about future.
They can ability which future. For example, when a person has a depression, maybe have a sleep disorder, okay, but totally normal. We can normalize the data, normalize the feature. For example, when a person has anxiety, maybe it cannot sleep very well. Okay, when you do neurofeedback, they can we can normalize the data, normalize the brain, and they can sleep very well.
Thank you. Thank you.
The NeuroGuide gives you the treatment protocol based on the recordings that you have taken.
Yeah, the NeuroGuide can, yes, the NeuroGuide can do that, but in my NeuroGuide software doesn't it, and I can't see you.
No, which software does not?
Yeah, but NeuroGuide software can give a report. Okay, but now I don't have this report.
Okay, so then how do we plan out the intervention based on the normal software?
We should buy it. We should buy it.
Right.
Yeah.
Okay, thank you.
You're welcome. Okay, thank you for joining us in this workshop.